welcome. Our topic is Drug Free India, Impact of Drug Free and Health Society. Introduction. Today, drug abuse has become a major social concern. The entire world is confronted with this problem in some form or the other. The society pays a significant cost due to people abusing substances such as drugs and alcohol. Illicit drug use is a serious concern since it poses significant health challenges. The younger generation is especially vulnerable to the menace being easily lured to drugs, be it for excitement, curiosity, or drug related risk taking behavior. At this age, peer pressure to experiment with illicit drugs can be strong, and those taking drugs tend to be either misinformed or insufficiently aware of the health risks involved in it. On the other hand, the use of drugs and alcohol is increasing. Among other factors, the fast changing social milieu arising out of this social and economic transition which the country is going through is contributing to the proliferation of drug abuse. The introduction of synthetic drugs and intravenous drug use leading to HIV/AIDS has added a new dimension to issue. Drug abuse is not merely a problem arising out of the availability and supply of intoxicating drinks and drugs, but has a great deal to do with the social condition which create the demand for the consumption of such substances. The vulnerability of modern society plays a catalytic role in promoting the consumption and abuse of narcotic and physiotropic drugs. The harmful use of alcoholic can have serious social and economic consequences for individual, families, and society as a whole. Drug overdose may even cause death. Drug use adversely impact the entire family and make its members, particularly women and children, extremely vulnerable. The family faces stigma, isolation, and constriction of resources. It is necessary to encourage individuals and families to seek early assistance for problems related to alcoholism and drug abuse. In December 1987, the United Nations General Assembly decided to observe 26 June as the International Day Against Drug Abuse and Illicit Trafficking. This was an expression of its determination to strengthen action and cooperation to achieve the goal of international society free of drug abuse. The international campaign by the United Nations Office on Drugs and Crime also aims at raising awareness of the major problem that illicit drugs pose to society, especially to the young people. Acknowledging the importance of having an addiction free society, our constitution makers had through the directive principles of state policy made empowerment of public health as one of the government's primary duties. In particular, it was laid down in Article 47 of our Constitution that the states shall endeavour to bring about prohibition of the consumption except for medicinal purposes of intoxicating drinks and of drugs which are injurious to health. In order to contain both supply and demand of drugs, the Narcotics, Drugs and Physiotropic Substances Act 1985 was enacted. This act makes stringent provisions for the control of illicit trafficking of drugs and empowers the government to establish Center for the Prevention and Treatment of Drug Addiction. Since last year, the Government of India has also started conferring national award to institutions and individuals who have made outstanding efforts such as awareness generation, research, and rehabilitation to address the problem of alcoholism and drug abuse. The institution of this national award is indeed a manifestation of the government commitment to address this problem and take effective steps in this direction. However, much more needs to be done with the active involvement of the entire civil society, with a view to reducing the demand for the consumption of alcohols and dependence producing substances. The thrust should be on preventive education programs and on reintegration of the addicts into the mainstream of society. The state should be on mobilization of community resources and greater community participation. Drug abuse is illegal and can cause severe physical and mental health problems. This is the broad definition of drug abuse as accepted by various public health bodies such as American Physiatric Association, Diagnostic and Statistical Manual of Mental Disorder, American Medical Association Committee on Alcoholism and Addiction, and National Commission in Marijuana and Drug Abuse. Population in drug abuse. Stage performers. Drugs are usually abused by stage performers such as musicians, singers, dancers due to the stress or fear they feel of performing on stage. The most commonly abused drug by pop musician is cocaine, as it provides alternance and a feeling of euphoria. These effects make the performer feel that they own the stage and help them deliver a high quality performance. Street youth. There is a high proportion of homeless youth due to several reasons like child abandonment, poverty, or poor socio welfare system. Lack of orphanages and runaway kids. They do not have enough guidance and healthy living and are easy targets for drug lords or drug trafficking. Street youth initially experiment with drugs for recreational purposes and later get addicted, which in turn leads to drug abuse. This makes them indulge in various antisocial activities. Drug abuse among refugees. The impact of high stress on refugees leads them to use drugs or physiotropic substances. Depression due to the separation from their family, anxiety because of language barrier, racism, discrimination, and physical trauma during pre-migration or illegal transit phases force these refugees towards drug abuse. Mainly to deal with the station mentioned above, refugees who are addicted to drugs require money to procure these drugs, and these make them indulge in crimes such as robbery, assaults, and various criminal activities. This in turn can lead to the formation of gangs and can slowly become a major security threat for the nation. Psychological effect of drug abuse. Euphoria and illusion. Drugs would distort to normal perception capacity and functionality of the brain and make a pseudo visualization and perception. It would create illusion and artificially make you feel euphoric, excited, or pleasurable. Stress. Drugs would make you feel as if it is helping you in relaxation and forget about all the issues that make you stressed. Long term use of drugs can cause a deep impact on the way your brain works and lead to increased anxiety and stress. Anxiety and depression. Feeling low after alcohol consumption is common. Some drugs would make you feel depressed while others make you depressed and anxious because of something that happened while you were under its effect. People often use drugs as a way to overcome their depression, but in reality, the drugs used can often worsen these mental illnesses. Scientists have showed that there is a link between drug use and serious mental problems like schizophrenia, yet it's still unclear whether serious drug use leads to mental illness. However, a person having any chronic psychological illness has an increased chance of drug abuse. Health and sexual effects of drug addiction. Accidents and injuries. Drugs distorts your perception and thoughts, and it would make you do unwarranted acts that would not do normally. Drugs can increase your chances of getting seriously injured or losing your life through fast and road accident and can even pose a threat or cause harm to others around you. Internal organ damages. Prolonged use of certain additives can cause damage to the internal organs such as brain, kidneys, heart, lungs, throat, and stomach. Continuous use of marijuana can damage your brain and destroy your memory, learning, attention, and understanding capacity. Risk of infectious disease. Needle sharing for infecting drugs and would put you at risk of catching serious diseases like HIV, AIDS, hepatitis C, hepatitis B, etc. Apart from this, sharing pipes or cigars would expose the user to infections like common cold, flu, pneumonia. Sexual effects. Illegal drugs are widely perceived as sexual stimulants and aphrodisiacs. However, the effect is often contradictory to the desired one. Cannabis drugs like marijuana are regarded as aphrodisiacs, increasing the good mood and sexual arousal by stimulating sexual activity. Tips on how to deal with drug abuse. Before treatment is initiated, it is necessary for to find out if the patient is suffering from any pre-existing mental issues that can make them prone to drug abuse. Doing a dual diagnosis is essential for success of treating patient with drug abuse. Take all the medications exactly as prescribed and do not stop unless advised by the physician. Never double the prescribed dose with the intention of overcoming drug dependence. Knowing and handling withdrawal symptoms of abuse drugs effectively. Cognitive behavioral therapy for developing problem solving skills. Participating in drug education or drug abuse awareness conducted by educational institutions or social welfare groups. Proper partnering or family care and support, attending motivational speeches and interviews, explaining the effects of drug abuse in pregnant women or who wish to conceive to avoid possible damage to the fetus. Socializing with friends and family frequently or involving in a social group will be of great help. People and drugs. Caffeine, alcohol, and other psychoactive drugs step into the wiring system of the human brain and influence the way nerve cells send, receive, or process information. This has led some researchers to categorize drugs according to the type of effect they have on the central nervous system. Though some may fit in more than one group, people have been using a wide variety of psychoactive or mind altering drugs for thousands of years to celebrate success and to help deal with grief and sadness, to mark rites of passage, and to pursue spiritual insight. Indeed, drug use is deeply embedded in our cultural fabric. Health promotion. Health promotion then encourages us to embrace this idea of well-being and in this process increase our control over how we experience everyday life. It is therefore less about preventing disease than about helping us manage our life situation, whatever it may, and reach our full potential. Health promotion pushes us beyond a disease-oriented individual lifestyle is key concept of good health. It focuses attention on things outside or individual selves, the social, economic, and environmental factors that impact our attitudes, decision, and behavior. And this play out every level of society from the individual through family and community to a national and even global scale. People have been using psychoactive substances for century to promote health and well-being.